Have you ever considered an exciting career in healthcare, but live too far from a college with healthcare programs? I am here today to tell you about the Respiratory Therapy program at Great Falls College, Montana State University. Join us on the journey to get started. Our respiratory therapy program is in an online hybrid format, where you can take all of your classes online 24/7 in the comfort of your own home, and then attend labs and clinicals in person at the clinical site closest to you. You never even have to come to campus in Great Falls, Montana. This allows the flexibility to study at a time that works best for you and have hands-on practice to learn at local hospitals. Labs and clinicals can be completed each week at one of our clinical affiliates. The majority of our students attend in Billings, Bozeman, and Great Falls, Montana. We are also excited to accept students in Alaska, with hospitals in Fairbanks and Anchorage becoming clinical affiliates with the college. In some cases, students in more rural areas can complete their first year of the program at their local facility, as long as a registered respiratory therapist is able to provide lab and clinical instruction. However, in the second year, the students will be receiving their intensive care and specialty clinical rotations, so they may need to travel or temporarily relocate to a hospital who can provide these services. Meet Jack. He is considering going back to school to become a respiratory therapist. His first step is to go to the Great Falls MSU website. First, he will apply for admission to the college. Once accepted, he can make an appointment with an academic advisor to determine if he is ready to apply to the program. The prerequisites to qualify for the respiratory therapy program include Human Anatomy and Physiology, 1 and 2, completed with a C or higher within the last 5 years. College writing and college algebra must have been completed with a C- or higher within the last 15 years. The program applications for acceptance to each fall cohort are available on the program website from mid-February to mid-May. However, you may still apply if you can complete the required prerequisites and submit your completed transcripts by August 1st. Once accepted to the respiratory program, you will need to start the process to complete a background investigation, drug screening, required vaccinations, and become a basic life support provider with the American Heart Association. Most applicants wonder what the time commitment is to be a respiratory therapy student, and if they will be able to balance work and family requirements. Hopefully, this chart will help you learn about the requirements, so you can determine if this is the right time and right program for you. In first semester, you will have 1-hour labs, in person, at the clinical site each week. There will also be 2 hours of live virtual sessions scheduled. You should also set aside 15 hours each week to study all the materials and complete the assignments. This part can be done at a time that works best for you. In second semester, you will still have 1-hour labs and 2 hours of live sessions each week, but you will also have one 12-hour clinical shift each week at the clinical site. Don't forget to also save 15 hours for studying and completing assignments. In third and fourth semesters, you will no longer have labs, but will still have up to 2 hours of virtual live sessions a week, and 2 8-hour clinical shifts for a total of 16 clinical hours. Depending on where you live, you will also need to allow travel time. The 15 hours of study and assignments still applies and is an important time to prepare for passing the national board exam. As you can see, on average, you should expect to spend 30 hours a week as a respiratory therapy student. If respiratory therapy sounds like an exciting career for you, and you are ready to get started or would like to learn more, we invite you to check out our program website. If you have further questions, please feel free to reach out to program faculty. Melissa Wells is the program director and can answer overall program questions or those regarding the online learning courses. Laura James is the director of clinical education and handles all the lab and clinical rotation questions. Thank you for your time, and we look forward to you joining our River Otter team of respiratory therapy students at Great Falls College, Montana State University.